Let's turn from there to the big story at home, the COVID emergency in Kerala. Kerala continues to report over 30,000 infections for a third straight day. The state government has appealed to COVID patients in home quarantine to strictly follow isolation norms to prevent the spread of the virus. The Kerala government, though, insists that its model is in place and that it is in control of the situation. Gopi Krishnan Unithan with today's report.
Kerala celebrated Onam and Bakrid with full gusto and is now paying for it. The state is now reporting over 30,000 COVID cases every day. On Friday, Kerala reported 32,801 cases, with the test positivity ratio above 19.22%. Kerala is the only state in the country with over 1 lakh active COVID cases. It contributed over 60% of the cases in the country on Friday. Under attack from all quarters, the left front government in Kerala has defended its strategy to fight COVID-19. State Health Minister Veena George claims 35% of infections are happening at home itself. She claims patients at home should strictly isolate themselves to stop the virus from spreading to other family members.
We are asking our people to have a COVID-appropriate behavior inside the house and also outside the house, to wear masks, to use sanitizers, to observe social distancing, and don't go for any social gatherings during the Onam season. No such celebrations was allowed anywhere in the country, anywhere in the state.
Kerala Chief Minister Pinarayi Vijayan, who is under fire for stopping his daily media briefings, has lashed out at critics in an article in the party mouthpiece Chinta. Vijayan accused his rivals of trying to create fear among the people. He questioned the critics and asked them to suggest an alternative if the Kerala model is incorrect. The CM stressed that no one had died in Kerala due to lack of oxygen. The opposition is not buying the CM's arguments.
ഇപ്പോൾ ചെയ്തുകൊണ്ടിരിക്കുന്ന എല്ലാ നടപടികളും പരാജയപ്പെട്ടിരിക്കുകയാണ്. അത് പുനഃപരിശോധിക്കാൻ സർക്കാർ തയ്യാറാവുന്നില്ല. ഞങ്ങൾ പല ദിവസവുമായി ആവശ്യപ്പെടുകയാണ്. നിലവിലുള്ള സംവിധാനം പരാജയപ്പെട്ടിരിക്കുന്നു.
While hospitals are not overwhelmed, the pressure is increasing slowly. According to the Kerala government data, 37.4% of ICU beds allocated to COVID patients are vacant now. Only 32.7% of ventilators set aside for COVID infections are available. The Union Health Ministry has held meetings with Kerala government officials. The centre has urged the state to strictly enforce containment strategies. With Gopi Krishnan Unithan in Thiruvananthapuram, Bureau Report, India Today.
So tonight, let's try and answer that big question. Has the Kerala model, the so-called Kerala model in fighting COVID, gone wrong? Why is it that Kerala's numbers remain high? Joining me now is someone who could hopefully answer that. Dr Gagandeep Kang, India's top virologist, joins me. Appreciate your joining us, ma'am. I want to start first with how you view the situation in Kerala. Is it alarming to see one state registering such high numbers even as COVID numbers come down in the rest of the country? Is there something about the Kerala model that we now, so-called Kerala model, that we need to worry about at the moment?
I think it is a matter of concern when you see cases rise in one location in a country. But we also have to remember that we are in the context of a pandemic that is evolving. So if we look at the numbers, we are in a situation where the serology data showed us that the whole country had a seropositivity rate that indicated that 2 out of 3 Indians had already been exposed to the coronavirus, whereas in Kerala, that was only 44%. And in each case, some of that was contributed by vaccination, and the proportion contributed by vaccination was greater in Kerala. which meant that Kerala had among the largest proportion of people that were susceptible to infection. We also have a situation where Kerala as a state was among the highest rates of testing per million population in the country until the beginning of August. Then they dropped their testing rates and they're currently at 19 tests as a test positivity rate, which clearly indicates that they are not testing and they're not detecting all the cases that they have. So that is a concern. We saw a smallish spike in Kerala after Eid, and we are seeing this larger spike now after Onam. What we had warned about was that there should be an avoidance of crowding, a push for vaccination. The push for vaccination happened, but the avoidance of crowding, I am told, did not happen in the same way that it should have leading up to Onam. So the consequences of that are there for everyone to see. Now, what's going to happen in the future? Well, the central government is providing Kerala with vaccines and they are vaccinating as fast as they can. They have the highest, among the highest coverage rates in the country. Certainly for mid-sized states, they are leading. We have currently 30,000 plus cases reported over the last couple of days with high test positivity rates. But what I would like to point out is that while all of India is reporting currently a test positivity rate of 3% or under, it's very important to look at what Kerala's test positivity rate has looked like in the past, because that explains how they test. And their average test positivity rate is at 12%, indicating that Kerala is largely testing people that it expects to find positive. So I think there are a number of factors there. The increase in cases is a concern. The hospital systems are not overwhelmed at the moment. Kerala has previously handled a peak with 40,000 plus cases being reported every day during the second wave. But we don't want to go there again, which means that we need to be increasing testing, increasing public health measures in Kerala, even as vaccination is increased.
But I want to understand, because, the fear, Dr. Kang, is that Kerala could lead to a third wave across the country. We are seeing breakthrough infections in parts of Kerala, about 5 districts where 5% and more infections are from people who are double vaccinated. Is that a concern that what is happening in Kerala because of these so-called breakthrough infections could in a way precipitate and be a prelude to a potential third wave?
Okay, so let's look at the pandemic and what we said would happen. We said once the bulk of the country is vaccinated or infected, we will wind up with situations where there will be pockets of individuals that will not be infected or vaccinated, and those will be the areas that will be more susceptible to infection and are likely to see flare-ups of infection. Now, that effectively is what we are seeing in Kerala. If we look at third waves, when will we get a third wave? We will get a third wave if there is a new variant. And we are told that from the genomic sequencing data in Kerala, what we are seeing is still 90% of the Delta variant. So there doesn't seem yet to be a new variant. The second reason why we might see a third wave is if we had pockets of individuals that were distributed not evenly through the population, but had networks that would enable them to spread to other pockets in states outside of Kerala. Now, if that kind of situation exists where there are susceptible pockets outside Kerala that Kerala can then transmit to, we might see more flare-ups in other areas and increase overall. That could lead to onward cascading transmission across the country. But we don't have pockets with that level of either connection or susceptibility currently outside Kerala. I could be wrong about this, but so far we have not really seen that there have been clusters of cases that have arisen outside of Kerala that came from Kerala. Now, obviously, more detailed data would be useful, but at the moment, we don't have that. So I'm not particularly concerned that this is a third wave that is going to roll across the entire country, but better data would obviously help. Where Kerala itself is concerned, what we want is for Kerala to be able to suppress transmission right now. And the best way to do that is by increasing their testing and making sure that where isolation, quarantine, and treatment of individuals is required, that is implemented. And that needs to go in parallel with continuing to avoid crowding wherever possible, placing restrictions on how many people can be in any location at any time, and of course, ensuring that masks and high quality masks are worn.
Ma'am, on Kerala itself, the the whole picture from what you're saying, does it suggest that the Kerala model has failed? Because a year ago, everyone was praising the Kerala model. Its health minister, Shelja, was being hailed by people. Its case fatality ratio, interestingly, was 0.4%. It's now 0.63%, but still well below the national average of about 1.4%. How are we to see this? Is Kerala a success story in fighting COVID? Or do you believe the jury is out and something has gone drastically wrong between 2020 and 2021?
Well, I haven't seen any data that tells me, other than the fact that Kerala allowed for people to congregate at the time of Eid and at the time of Onam. I have not seen anything that Kerala has done that is wrong. Now, I understand that there was a national group that went to Kerala a few weeks ago and came back and said that Kerala's tracking of contacts and testing of contacts is relatively low. I think they said 1.2 to 1.5 per case. And that is low, but there are two things to consider here. One is, how good is it in other states as a comparison? Because the government recommended that there be 12 to 15 contacts traced for every case, and some places went up to the multiple tens for tracing in the initial stages of the pandemic. Is that still something that is relevant to push to that level when you have tens of thousands of cases? That's something that modelers say loses value after a while. So I think the government should look at whether its recommendations should change. And if they think that in the Indian context, given our social mixing patterns, we should not be changing that recommendation, then yes, every other state and Kerala should do better on doing contact tracing and testing. Other than that, and the crowding, which I mentioned earlier, I'm not sure what Kerala has done wrong. In fact, if you look at any other quality parameter on what should be done in order to ensure that there is control of the pandemic, I'd like to know what else Kerala should have been doing. Their hospital system is not overwhelmed. Their testing rates, even though they have declined for Kerala at the beginning of August, they've recently picked up over the last couple of days and should go higher. But they're actually testing at much higher rates than many other states in the country. So I'm not sure what else we are expecting from Kerala in order to be able to suppress this flare of the virus.
Okay, Dr. Gagandeep Kang, trying to explain what's happening in Kerala. Appreciate your joining us. Remember, this is an excerpt from a full interview that we've done with Dr. Kang. The entire interview will play up this weekend. COVID dialogues with Dr. Kang. She'll tell us, is India heading for a third wave or not? She's making it clear. She doesn't know what Kerala has done so wrong, because on quality parameters, Kerala seems okay, particularly case fatality ratio. Maybe we should listen to doctors rather than WhatsApp universities.